Dr. Sam, here to coach you to bright, clear skin like I've done for thousands of patients at my Harley Street clinic. Today I want to share with you some of the commonest mistakes I see when it comes to treating acne. A common disorder, we've been talking about it now for a few weeks, but one where I see mistakes all the time when it comes to the right approach to solving breakouts. Now, the 4 mistakes I'm going to cover today all have something in common. They aren't going about addressing acne on a daily basis. And when you think about what causes acne, it makes sense that they won't be successful. So we start off with the sebaceous gland, T-zone, chest, back. They switch on at puberty, they start to make more oil, and under the influence of hormones, skin cells at the opening of the sebaceous gland follicle, the pore, start to clog up and form little comedones, blockages that with the excess oil lead to the overgrowth of the acne-causing bacteria, C. acnes, which creates inflammation. Inflammation equals spots, papules, pustules, cysts, and nodules. So with that process in mind, let's look at a number of things. The first one, patients are always asking, Dr. Sam, should I have a facial? And the answer is almost always no. The reason being that those events, the clogging of the pores, the excess oil, the bacterial overgrowth, and the inflammation, all need to be regulated on a daily basis. There is nothing a facial can do that can influence those things with enough impact to actually really make a difference to breakouts. You can't regulate oil. You certainly can't make pores become clear and stay unclogged with something you're doing once a month. But then factor in the fact that you're using products that might also potentially clog you up because you don't have the control over what's being used on your skin, and the use of friction, and dare I say it, extraction, and you actually have a recipe for making breakouts worse. So in my view, facials have no part to play in managing breakouts. Now, by the same token, when it comes to friction, physical exfoliation comes up. Is there a role for physical exfoliation in the management of acne? And again, my answer has to be no. Acne does not like friction. In fact, we see acne definitely occur at the sites of friction. It is part of what's triggering masking, the epidemic of problem skin that we've seen since we started having to wear masks as part of social distancing. So physical exfoliation has no potential to unclog what is happening within the hair follicle. That is the work of beta-hydroxy acids and retinoids. The next thing we come on to is masking, something that has grown in immense popularity over the last 12 months as part of self-care, and lots of masks position themselves as part of an acne solution. And again, the same problem persists. How can you regulate something that needs to be dealt with on a daily basis with something that you do sporadically for short periods of time? So in my view, for breakouts, masks have a role to play, certainly in recovering barrier function after you've overdone something like too much retinoid. But as part of your management strategy, it's going to fall apart. And then the next thing, the final thing I want to talk about is incorrect use of the tools that I think are important. And the commonest is probably the wrong use of retinoids to spot treat. So spot treating with retinoids makes no sense. The reason we use retinoids is largely to normalize keratinization. They do have some anti-inflammatory benefits, but their main role is to stop the comedones from forming in the first place. And to do that, you need to treat the areas that you are prone to blemishes. People are very rarely prone to blemishes in just one place, so it often makes sense to use them all over or in dedicated zones, what I call zoning of your acne treatment. So individual spot treatment with retinoids will not work. So a bit of a theme here today. Essentially, lack of consistency is at the core, whether it's monthly facials or just sporadic use of a spot treatment. Ultimately, the path to skin freedom is about consistency using the right tools. And I hope that this series of videos has really helped clarify that, what you need to have in your toolkit to achieve skin success. Because it's so worth it. The results that you get for putting the right plan in place the reduction of noise in your mind, not fretting about what's come up overnight, because even if something has occurred, you know you've got a handle on it and you've got the tools to take care of business. So if this has been helpful, please do share it with someone and hit the like button so I know that our content is hitting the spot. And I'll see you guys again soon. Bye for now.